Hi, I'm Thomas. Aaron and I would like to share a story about a friend named Andrew Semesco who died from oral cancer when he was 21 years old.
Our goal with this video is not to lecture you, but to educate you about oral, head, and neck cancer.
On September 29, 1977, Andrew Semesco was born. When Andy was young, he came to know a group of people that ended up being his best friends for life. In high school, Andy was an active student, an athlete, and he graduated with honors. Andy then attended Florida State University.
When Andy was 20 years old and entering his third year of college, he was leading a pretty normal life. He was an officer in his fraternity and enjoyed spending time with his friends and family.
He was in college, and third year of college, and in a fraternity, going to school, had a girlfriend, just, the usual 20-year-old activities, having a great time. Life was wonderful. Loved his fraternity and his fraternity brothers.
Then, on October 29, 1998, Andy was diagnosed with a form of oral cancer at the base of his tongue.
I remember when we heard what was going on, nobody really knew exactly what to make of it, because you hear about cancer, but you don't really know what it is. You don't really know how it works. You don't even really know how it harms people. You just know cancer is bad, and eventually, it kills people.
Andy was one of those special people. You immediately liked Andy. And when I first saw Andy and heard that he had a problem, I found it hard to believe, because he was young, and he was strong, and he was healthy, and he was a student, and it was just one of those things where I didn't want to believe that he had a cancer.
What is oral cancer? Oral cancer is found in the mouth, on the lip, and in the throat. Both the oral cavity and throat are made up of several different types of tissue. Many different kinds of cancer can form in these areas. Andy's cancer began on the bottom of his tongue.
Oral cancer really has 5 different appearances, and it's very tricky, because they often start out as looking very innocent. They can look like little white fluffy areas on your gum or on your tongue. And other times they look like little flat white spots or red spots, or they can be even mixed, red and white. When they get older and they've been there longer and they've grown for a while, then they start getting to be really large growths that can grow out into the mouth and look like a head of cauliflower. They actually look like a white thickened area. And then other times they'll grow into the tissue and they'll feel like a rock hard, ulcerated mass, like a sore, and they don't hurt. And that's one of the things that's really bad, is that patients, since things don't hurt, oftentimes they don't present until they've already had the cancer spread throughout their body.
Following are signs and symptoms frequently associated with oral cancer: a sore in the mouth that does not heal, the presence of a lump or a thickening in the cheek or neck, the prolonged presence of a white or red patch in the oral cavity, prolonged sore throat, numbness or swelling in the mouth, drastic weight changes. Any of these symptoms could signal the presence of cancer. Therefore, it's important to seek the professional opinion of your dentist or doctor if you're concerned.
Andy didn't do the usual things that would put him at high risk for cancer, and we can't prevent the unusual from happening like it did to Andy. But through our friend's battle with this disease, we've learned that certain activities can increase your chances of getting oral cancer. Smoking, dipping, and chewing tobacco greatly increase one's risk for developing lip, gum, and cheek tumors by as much as 50 times.
According to the American Cancer Society, 90% of people with oral cancers are tobacco users. Smokers are 6 times more likely to develop tumors of the head and neck than are non-smokers. Pipe smokers are more prone to lip cancers, and cigar smokers are at higher risk for tongue and other oral cancers. The nicotine in these products is highly addictive, so quitting may be difficult.
What happens when you smoke is that there are cancer-causing compounds in the smoke, and they're called carcinogens, or chemicals that cause cancer. And what they do is they actually damage the cells. And in the cells you have genetic material which is on a chromosome. And these chromosomal changes are called mutations. Now typically when you get mutations in critical areas, that's what causes cancer.
You think that cancer in general, and specifically oral cancer, affects older people only. However, research in the area shows that younger people are often influenced as well. Prolonged use of tobacco products like cigarettes and snuff is not required for someone to get oral cancer. As a friend of Andy, I know this disease can affect young people. I would like to encourage you to check your mouth routinely and ask your dentist for an oral cancer screening at your next visit.
While there are no guarantees, we do know that these behaviors over time can increase the chances of developing an oral cancer. So why take the chance? For you, it all comes down to making wise choices.
Patients who are treated for oral cancer go through quite a bit of suffering. There are three main ways in which oral cancer can be treated: surgery, radiation, and chemotherapy. Each of these have terrible side effects. Surgery involves removing a piece of or the entire tumor. Sometimes people will lose a large part of their tongue or jaw, which affects eating and speaking.
And I've seen patients who have had, that I've operated on, that I've had to take out part of their tongue, and they'll talk like this, and that's the way they talk the rest of their life. And it's very difficult for people to understand them.
Radiation treatment is used to stop cancer cells from growing. Radiation is aimed like an X-ray at the tumor. Unfortunately, the radiation also kills the normal cells around the tumor. Radiation treatment kills the salivary glands, leading to a very dry mouth, and it can also cause people to lose their teeth.
So after you get radiation, it does affect the salivary glands or the spit glands, and so these people are walking around and their mouth is so dry that they'll often have a bottle of water in their hand and they're constantly drinking water. It also ruins their taste, so that the things that they used to love to taste and the things that you love to taste and eat, you can't enjoy that anymore.
Chemotherapy means treatment with chemicals. These chemicals affect every part of the body, even though the cancer is only in the head and neck. It leads to people losing their hair and becoming very sick to their stomach.
And you've all seen somebody who's gotten chemotherapy. They lose their hair, they get sores in their mouth, they get really sick to their stomach, they can't eat.
Unfortunately, oral cancer survival rates remain low.
Half of the patients that I have treated with any of those kind of treatments or any combination of them, half of them have died. If you yourself start smoking, please do everything in your power to stop, so that you don't end up being one of my patients or being one of those two who will die if you get that cancer.
Andy did not have surgery for his tumor, but was treated for several months with radiation and chemotherapy. He experienced several of the side effects we have mentioned. He lost his hair, lost his salivary glands, and sense of taste, and he was very sick to his stomach.
So what can you do to prevent oral cancer? The biggest things you can do are not smoking and not using smokeless tobacco. Also, you can ask your dentist for an oral cancer screening during your regular dental checkups.
The key is that you need to go for regular dental checkups and not wait for something to hurt or something to be really massive before we start to treat it.
Andy battled his cancer for 5 courageous months before it overcame him. On April 1st, 1999, after being in the hospital only 4 days, Andy Semesco passed away. Andy was 21 years old. He left this earth with all of his friends and family by his side.
And we're all sitting around the bed, and he just looked up at every single one of us and gave us a smile, shook our hands. You know, we all gave him hugs because we knew that this might be the last time we'd ever see him again. And it was then I leaned over and I made him a promise that I would do everything I could to make sure that what happened to him didn't happen to other people.
What I miss about Andy is his positive attitude and his love for life. And even when he was very sick with his chemo and x-ray therapy for his cancer, he said,
It's kind of ironic to say good things can come from bad things, but I truly believe it. I began to realize the type of friends I had and how wonderful and caring they are, and how precious life is, and not to take things for granted. It has really changed the way I approach life and other people with problems of their own.
And if this video will help a young person from getting cancer, then something good has come from this.
Andy's story touches all of us. It's his memory we preserve forever. Andy left us at a young age, and it's our goal to help educate teenagers and young adults to make good health choices.
Just remember, what you do today can have a big impact on your health in the future. From all of us here at the Andrew J. Semesker Foundation, thanks for watching.